all of a sudden it's an adverse deal to where the horse was worse,
Right.
or anything like that.
Okay. I just want to make sure I was right.
It's difficult for me to imagine where oxygen is going to harm anything. Good healthy blood flow is going to harm anything, unless we're talking about enhancing the absorption or enhancing the metabolism. I mean, I'm sure that there are drugs that they, or medications that they administer, that they're understanding that we're only going to get 20% absorption through the through the metabolism of the horse, or 30%, whatever that number happens to be, and someone to come tell me, oh, we're going to get 50%, they might say, maybe I shouldn't give so much. Well, that's not my call, and that's not our call to get in the way of that.
Right.
If someone's giving a medication and they understand what that absorption level is going to be, we don't need to change that. For example, you can drink 2 glasses of wine while you're treating yourself, and you've actually had 3.
I was curious about that.
It is true. You can also buy a cheap box wine, put the coil over the top of the wine, white wine, and you make it a fine wine. And that is true. I've done the tests. I used to do it a lot. Okay, we want to do the wings. Let's do the...
Oh, I can just see that water spilling all over that machine.
So we wanted to show, can you pull that up a little bit? We wanted to show the semi, so you understand the difference between the semi and the max, and we'll come up, that's good. Okay, Deanna, oh, you got to unplug the thing, I'm sorry.
That's good. Make sure it's turned down.
Any other questions while we're getting fired up?
So I'm working on a horse with nasopharyngeal cicatrix, and I'm not sure, from what I understand, it's only something...
What was that?
Say that in English?
Cicatrix. And it's something that is just secluded to South Texas.
Okay.
And it's scar tissue on the pharynx.
Okay.
And so it'll build and build and build.
Okay.
My client has a 1D pro rodeo horse, and she started slowing down. She was doing the protocol. The vet gave her mouthwash. We were nebulizing everything. Started doing the Magna Wave, and I was treating her just like you were showing up with the flapper, and the mare has started running more comfortably and freer and back to clocking. And so I guess, and so the question, that's scar tissue. I'm working on the scar tissue. We haven't had her scoped yet. We're waiting to get her scoped in a month to see the difference, because she's been scoped 2 or 3 times in the last year. So what I'm working on is the scar tissue with this.
Absolutely.
Right, and so it's reducing the scar tissue.
Well, what it's doing...
I'm experimenting with it.
Okay, no, and we've been doing scar tissue, cosmetic surgery tissue, all that kind of stuff for years. And even before we got involved, people, I would say, progressive cosmetic surgeons have used PEMF therapy probably for 30 years, because it reduces the scarring after surgery. Almost makes it, in many cases, not apparent. All right? And so from the concept of what you're talking about, are we going to reduce scarring that's already occurred? No.
Okay.
Can we soften scarring that's occurred? Yes.
Okay.
Can we slow down the development of additional scarring?
Yes. Okay.
All right. It's kind of like arthritis. If you've got a buildup of arthritis, which is a buildup of calcium on your joints or wherever it is, and so it's the calcium that's irritating the nerve that's creating the pain. All right. If we can take that pain away, then you don't feel like you've got arthritis. It's still there, right? But we can also slow the development of the calcium on the joint. My family has horrible hand arthritis. Everybody's got bigger joints, you know, inflamed joints and all that kind of stuff. Because I've been doing this for 17 years or whatever it is, I don't have that problem.
Oh, I see. Nice.
Okay? The calcium has never built up to the point that it has become an issue. I have some issue here with this thumb, but it's from this elbow. Not from anything else.
Can I add something about that?
Please, come step in.
Existing scar tissue, I use the EMF a lot on animals, small and large, that are very arthritic. And you're going to get soft tissue scarring around those joints as well as calcium deposits. So my goal with EMF is to try to reduce inflammation and prevent additional deposit like Pat was saying, but existing scar tissue, in that case that you're talking about, or in any case that's got any kind of scar tissue in a muscle, you know, the quads on them or whatever, there's an enzyme called serrapeptase. It comes from the silkworm. The larva produces it to digest its way out of the cocoon. It only digests dead proteinaceous tissue in the body, which scars have a lot of protein in them that's non-viable anymore. Won't hurt normal tissue. I would suggest putting that horse on serrapeptase.
Therapeutic.
Yep, I use it a lot in my patients. I've got personal experience with scar tissue that went away when I was on that as well. I take it every day, avoid arterial plaques in my body. I don't know that I've got any, but I don't want any. Plaques in the arteries are made up of a lot of fibrin tissue, so inflammatory and so on, and it will help digest those away. Anyhow, it's something that I use for existing scar tissue.
That's the kind of stuff that when we start our webinar programs again, and Dr. Nye was kind enough last year when I said I want to do this, he said, I'm in, let me do it. And I haven't had a chance to get to it. We're going to go there. But.
Can I ask another question? You were talking about essential oils. I know whenever I have my little box of magnets next to my essential oils, it will change the molecular structure of the oils. I always keep my magnets away. So does that have anything to do with applying the oils to the horse and then doing the Magna Wave? Or because it's already absorbed by the body within like 20 seconds?
Yeah, I use a lot of oils in my patients, and I don't know how familiar you are. Or
I'm very familiar.
Use them, so I use raindrop technique a lot.
Yes,
there are
I'm familiar
10, 12
with it.
oils in insertions. I treat a lot of anxiety in small animals, in particular dogs. Probably 80% of my patients have anxiety, 60% are actually affecting their health quite a bit. So I use raindrop technique a lot on them. I'll tend to do it after I do the EMF treatments.
Okay.
Not specifically for that reason. It's mostly because I don't want to expose the coils
To the oils
for
that can
degeneration
penetrate
over
the
time.
plastic.
But there are some patients that I will treat prior to because they come in so anxious, and I'll get that calming effect before I treat them then. So I don't see a change in the effect of the oils in the body when I expose the body then to the EMF. So I guess I'm not too worried about it.
Okay.
The other side of that issue is you're putting static magnets near your oils.
Right.
Total different animal.
Okay.
Total different situation. A static magnet has properties to pull and change things from the magnetic pull of the magnet.
Okay.
Okay, could that have an effect on the oils? I guess it can.
Yes.
We're simply creating a field. We're not pulling anything. Put a piece of metal up here and it's not going to pull it over there or anything like that. It's not going to my belt.
Okay.
Oh my God! You know.
Yeah, truly, right?
So that could have some basis on what you're
okay.
experiencing.
Okay, cool. Good.
Okay.
Thank you.
What setting is that on, teacher?
Okay, so this is a semi on the medium setting.
Not like you.
And Jill's horse is pretty good up here. If I bring it back here, I'm getting some movement on the medium setting. A little bit. Put it up to high. Relax. So when I put it on a higher setting with the semi, I'm getting more movement here. When I come back up to the shoulder, still getting very little, which is basically telling me he's more solid, he's good shape on the shoulder than better shape than he is on his hips.
Now, when I treat my guy who has arthritis in his hops, he used to be bad over his loins and hips, and did not like high at all. But now he's okay with high, he's less sensitive. Is that a sign that things are getting better?
Yes, absolutely. Absolutely. So we're demonstrating the wings here so you can understand what you'll see when you use the wings, whether it's on the semi or on the. If you're doing it just if a person is treating their horse and they just want a good overall body sensation, get some massage into the body, this is fine. If we want to figure out what's going on where, this is not as accurate. Okay?
I'm finding that I get more my movement like from here up, not so much down through here. Is it still you're doing your?
You're still getting it, but what's happening is we're losing contact here. If you come back and you do this, you see we picked it up there. Contact is important.
Right, and I've done that at times where, again, there's a lot on sore areas, maybe a lot of movement up
Right.
here and not so much down
Right.
here. And I just want to make sure for me, yes, they're still getting it.
Oh yeah, they're still getting it.
Okay.
They're still getting it. You know, I'm getting it now, but I'm not getting it like I'm doing it here. I mean, it's here. I'm getting it, but when you move it away from the horse, and that's one of the ways with the semi, you have to control it. If this is too much for a horse, which we've put this, Deanna, on a horse on high on the semi, and it's more than the horse can tolerate, we have to do this.
Right.
We have to raise it up to create some space. So when you raise it up a quarter or a half an inch off the horse, you're diminishing the intensity by a half.
Right. No, my question is, with the loops being so big, is it still going all
Oh,
the way
absolutely.
through?
It's coming out like this.
Okay. Gotcha.
Okay.
That's what I wanted to know.
Yeah. It's like a fountain.
So I have a question. When you talk about raising it off the horse, we had a barrel horse that ruptured a suspensory at
Okay.
a barrel race, and they had wrapped it, put a compression, put wrap on it and standing wrap and around the outside of it. And she asked me, she come to me, asked me to treat it, and I said, yeah. Well, we didn't remove the wrap. I used the paddle on a real high setting, and we treated it like about 30 minutes. And the next day, they took it, that was on a late Saturday night. Sunday morning, they brought it up to, I believe, Rood and Riddle, may have been Hager. But they told them that what we had done had actually cut the horse. Instead of being off 6 months, they said it was awesome, that it only needed about 6 weeks off and go back to riding. There was no, you can't even see, most of the time you can see when it happens, that you can't even tell it. But that was my question. I treated it outside of the wrap instead of taking the wrap off.
It'll go right through the wrap.
Okay.
I've gone through a cast
Oh yeah, it'll go
before.
through a cast, it'll go through
But I
wrap.
didn't
Now
know if that
certainly the
reduced it.
resistance is going to have some bearing on what's happening.
Yeah.
But it still goes through.
Okay.
That's kind of like the hoof
Yeah.
box and the paddle.
Right.
And we've got that very dense piece of rubber stall
Right.
padding on the top of it. But it's a thinner piece, and it's going to go right through that.
Yeah, and it works great.
Yeah. I mean, so would you get a better intensity if you took and just put the paddle on the horse's foot if you wanted to put it on? Yeah, I mean, but not enough where it's going to make any difference in what you're doing.
Okay.
If you want to stand here and hold that foot up for 8 or 10 minutes,
Exactly.
I don't like to do that anymore.
Is there a ceiling on the amount that, like if you treat an area for 30 minutes, is there like a ceiling effect, like you can't get any more?
If you're in an area and you've gone more than 15 minutes for any reason, it's over.
It's over with. Okay,
So really,
yeah.
I just needed to do one
Okay.
round with it.
Yeah.
Okay.
I mean,
Will you explain why you're using a semi, why you're using the XL blades to show people? Because they wonder why you're doing this.
it's one of the most frequent questions we
Yes,
get.
that's what I was
If
talking
I'm doing a semi, what's the XL wing going to do, or how's the semi going to react? Let's put the wings on the mats. We can use the other coils if we want.
They were just wondering,
Yeah.
you kind of had a good spiel about,
Yeah.
we get asked that all the time.
We get asked
about
all the
wings
time, and so people
and
want to
semis.
understand. And here's my logic. There are people out there that are using the wings, they're treating from the neck to the back of the horse, and that's all they're doing. And we had the wings available to us 10 years ago. I just didn't want to do it because my logic is let's find the areas of sensitivity and treat those areas. And we can do that. Right? You don't have to do that. The first thing I tell somebody years ago, if somebody buy a machine, and I'd say, fine, when you get home, when you get the machine, you call me. If you don't want to come here, if you don't want me to come there, you call me, and I'll tell you how to use this machine in 20 minutes. Because you can do that. Right? Then I say, put it on this setting and treat the horse. Treat the horse on this setting, the whole horse. You're doing good, but you're not reading what's there. After you've treated 50 horses, you're going to understand. If I turn it here, I'm getting this. If I turn it here, I'm scanning that. You're going to learn. I used to spend hours talking to people about put it here and do that, put it here and do that. You know what they do? They wouldn't do it. they just wouldn't do it. They'd have to do it 50 times, and that's my number. Treat 50 horses, and you'll learn can't tell you how many times somebody's called me up and said, I got it figured out. Thank God. You know, we've been talking and talking and talking and talking. But
This isn't
after
on,
a
is it?
while, you're going to get it.
No idea.
Are you on?
Yeah, it's quite interesting.
Here we go.
It jumps differently.
It jumps differently. The reason it jumps differently is the semi puts out two signals. It's got one signal that's a low, what we would call a low frequency, but actually the frequency is the number of times it clicks. So it's really a high frequency signal that's going. And then there's a lower frequency signal which clicks every second and a half on the signal. This can go up to where it clicks every second. When it clicks every second, you never get there, very rarely. Maybe on a foot, ankle, knee, something like that, you'll get it up to its maximum power. But what this is doing is it's in that range of a very fast signal, but we're already above that, so we're getting movement everywhere.
So this tells me he's got significant soreness in his hips.
More so on this side than this side.
Yes. Okay.
So you can still use this to see where he's at. Now, some of that has to do with how he's standing too, but it obviously it's more here than it is here. Even if you're wrong, right? If there's something there, but if you're not exactly on, you're still doing it.
Gotcha.
And you can come back with your paddle or with a butterfly and search for the spot. I had a thoroughbred in Florida a few years ago, and the veterinary. I was going through my Dr. Voodoo stage in Tampa, and the vet calls me up and says, "Okay, Dr. Voodoo, take your magic little box, go out to this barn and treat this horse and tell me what's going on with it. I know it's in his hip, it's in his rear end, but I can't find it." Right? So I went out there and I didn't have this at the time. So I treated him and found some issues, a little bit more, and it was on this side, found more on this side, treated him, spent half hour, 30, 40 minutes maybe, went back to the track the next day. He ran a little better, but nothing that anybody was excited about. So I went back out to the barn and I spent about an hour on him, and I just really took my time, and I found a spot right there. When I got there, that thing just bang, 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 bang. So I treated him. He went to the track the next day and ran like a champion.
What attachment was that?
I was using the butterfly. Closed.
The small one?
Yeah, didn't have these then. Had them but didn't use them. Didn't want to do that, which later bit me in the ass. But at any rate, found the spot, treated him, he went to the track, great. Only lasted a day or two. So we came back, we treated that horse 3 days a week for a month before he went back to New Jersey. And we continued to work that spot. He ran all summer long with no issues once we got it to the point. So I went back to the vet and I said, okay, so what was the deal? We know where it is, but what was the deal? He said, to me, there's a Charlie horse going on down there, that when he has stress, the Charlie horse sets in. So he's fine in the stall. He was fine walking to the track. Jockey up, he'd be great. As soon as he'd hit that turf or that practice track,
Put stress on it.
he'd tighten right back up and wouldn't go. Once we got his memory to the point that he didn't worry about that all the time, didn't have, we all understand. They talk about this at Derby. When those horses come out on that track at Derby, they're in a stress situation that they have never, ever been in. And it has a tremendous effect on that horse's mind and what it's gonna do. So just to think that, taking that horse from the barn to the practice track, that's not any stress. Bullshit. That horse knows what stresses it out.
Yeah.
And so the vet said he had a Charlie horse there that just wouldn't release.
Gotcha.
And every time he got stressed, it fired back up and pinned him up on the track.
Tells me
Off
we
the
need
track, he was fine.
We need to treat our youth riders, and that'll take care of the horse underneath them.
Absolutely.
Could be a good point.
Happy show up the other
Because the minute they get ready, they just
Oh
like,
yeah, so thank you. So, you can use these wings if you're doing an overall body type of treatment. So now we can get the entire top line.
Son, I never thought about that.
Yeah, you're getting the top line, you're getting the GV 12 and 14 and the Bowie, so you're getting the acupuncture points as well.
Right.
Plus the longest dorsal, your glutes.
And you come all the way back, work his rear end as well, his glutes.
How long was you left there?
3 or 4 minutes, 5 minutes. Any other questions?
I have just a story to share.
Okay, I like stories.
It's a big warm blood horse. He's been coming into our clinic numerous times. Cannot find the source of the lameness, hind end lameness. It's worse in the corners. Blocked it, couldn't get it. Finally, they blocked the high tibial nerve in the right hind. But it was only maybe 80% improvement. So this girl is at her wit's end. She's 7 years old and can't do it. So they brought her in for a Magna Wave treatment just to see if we could diagnose where it was sore, or pinpoint where it was sore. This horse was so sore across his back that it's the only horse I've ever not been able to get near without sedation. So he's currently being treated like his whole body, but especially on his back. So he's only had 3 treatments so far, but I'm going to be curious to see if that treatment does anything behind it.
Well, you know, we've had situations that a block will do something, but there's still some inflammation in the area. There's still something going on that we can just enhance a little bit and change the outcome tremendously.
So I went ahead and treated the horse almost like you are now, so with a smaller coil, and I treated his leg. So that's a good start?
Yeah, absolutely.
I have a question. People constantly ask me, okay, well, it's obvious on the torso, on the neck, where they're sore because the body's going to show you. And they ask me, well, how do you know on their legs if there's an issue? And I tell them, I try to read the horse, and the horse is going to tell me when it hurts, and then I know there's an issue right there.
What I do, or what I've done when I was doing this actively every day, is if they tell me it's a hock. Now, number one, we all know that every horse is not going to let you approach its hock.
Right.
And it's not going to let you turn up the machine very much. So let's talk front knee. You can do it on the hock, you can do it on the ankle, you can do it anywhere. But if I've had and I learned this at an Arabian show at the Kentucky Horse Park. Guy comes in, rider comes in, and he looks at me and he says, I think this horse has got something going on with its left knee. I don't know, and I don't know how to really, looks fine. Okay, so I went to the horse, I put the butterfly on the horse, and I began to turn it up. And I turned it up, I turned it up, I turned it up until he started doing this. Okay, he did that. I took the coil off, did not touch the machine, I put it on the other leg. And he just stood there. He didn't care. No sensitivity in the right leg, all in the left knee. So we knew, so then he calls the vet. I've got other stories about how we've used this with veterinarians before. Calls the vet comes in, does his job, bingo, things are better. Or we could have continued to treat the knee. You can do the same thing anywhere on the horse. Just like we'll find sensitivity here, and I'll just slide it over here and see that there's not as much sensitivity.
Right.
Okay, so you can do that. We can do the same thing to the extremities. Okay, so, but when you get up to the knee and you treat it, and he's doing this, and you take it off, and you put it on the other knee, and he does this, you got one or two things. He's either sensitive in both knees, or you've turned it up high enough to cause him to move his leg. So there you got to read what's going on.
Right.
And they could be sore in both sides. I had a situation up in Michigan. Went in and treated this $1 million jumper. Went in and treated it, and I got some activity in the stifle that I don't normally get. When I started and I went to Churchill Downs, every horse had stifle issues. You'd talk to the trainer, what's going on? Oh man, this horse stifles really bad. Okay. I'd get over here, nothing. I'd come up here, boom, boom.
Yeah.
I'd get up on the neck, and you got things going on. So I treated this horse, and I got some movement in the stifle. So I went out and talked to the owner. I said, you know, I saw some sensitivity in the stifle that I don't normally see. Perhaps you should have your vet check it. Perfect. Well, her vet was Dr. Haynes Stevens from Chicago and Wellington, Florida, and I know him very well, and so she calls Haynes. And so I'm treating another horse, and Haynes comes walking into the shed row, into the barn. He sticks his head in the thing. So you think that horse has stifle issues? I said, no, Haynes, I didn't say that. I said there's some sensitivity in that horse's stifles that I don't normally see. He said, all right, I really appreciate you telling him. I'm going to check it, but I think it's all sacral and in the hip. Perfect. So I'm going on treating the horses. And Haynes comes walking down the hall, and I'm thinking one or two things are going to happen. He's going to walk by, or he's going to stop and say, "Keep your damn mouth shut when you're talking about these horses. It's not your business. You just treat them and do what you're doing." So he walks by, and I'm thinking, "Whew, God, there he goes," and he stops and sticks his head back in the stall. You were right. I had to treat both stalls. So, not that we are diagnosing, but if you see something, you're going to see that. We're going to introduce you to the app today, the Magna Wave app, and you've got great ways to keep those records and share that stuff with your clients and so forth. But that's my story on stifles. Okay.
Okay. Well, this goes back to what she was saying about saddle fit. All these, especially the English saddles, all your weight's they don't have very wide trough through them, and you're putting all that pressure down on these ligaments, which inflames them.
Right.
Running down the heart.
Right. So your question is?
Well, I was just saying where a lot of this problem with all this hind end problems, and Western saddles are even worse.
Again, I've been around horses my entire life, but I've never been a clinician. I was not a clinician.
I'll tell you someone, if you want someone to come in and talk about saddle fit and crap, he pays half of it.
Yeah, okay. But what I learned and when I went back to treating, quit selling therapy equipment and began administering therapy. Number one, everybody thought I was nuts. What's this sales guy doing his stuff? And but I went to people and I said, "This is what I do." And if you want to back him up, understand something. At Churchill, they just took me around and told me where to walk, where not to walk, who to talk to, who not to talk to, and that kind of stuff. But I had some jumper trainers. Lost my train of thought where the hell I was going. What were we talking about? Saddle. When I learned that the weight of the rider, the strength of their legs, the angle of how they're sitting on the saddle, I'd sit on the fence and we'd be sitting there and this trainer would be watching this horse go around shooting this stuff out, and I'm thinking, what the hell are they talking about? That horse looks fine, but then you start learning this person doesn't have the strength in legs is incredible when you're talking about performance horses, how you're going to guide the horse, saddle fit is incredible. I can't fix saddle fit. Are you going to treat my horse one time and it's better?
You'll put the saddle
Replace
back on?
the saddle, get different shoes, then maybe you'll get a longer result.
I have another question. I've got one gelding that when I treat him up over his withers and his shoulders, he's real muscular in his shoulders. And basically, he's fit, he doesn't show a lot of problems, and I can treat him, he loves it. But when I finish, for about 2 minutes, those muscles will sit there doing this. Even with no Magna Wave or anything on him.
It's not unusual for that to happen once in a while. It's an anomaly. It doesn't happen all the time.
He does every time.
But you can trace that back, and I'm going to ask Doc, maybe he might add to this, but you can trace that back in a lot of cases to electrolyte imbalance or shortage or a nutritional shortage or something like that. That's allowing their muscle magnesium, if they got plenty of magnesium, that's not going to happen.
And he's on magnesium supplements.
But I can't address that. But when you put the whole nutritional package together, electrolytes, magnesium, hydration, all that kind of stuff can have some reflection on the moisture content in the muscles and how they respond to this stimulation. And they may continue after you treat, and that's not a bad thing.
Yeah.
Unless his eyes are screwed. If he's sitting back there doing this and he's like this, then there's something going
relaxed.
on. So I wouldn't worry about it.
I just have, it's the only horse I've ever had to do that.
I've never worried about it.
Yeah.
And it's never been an issue. Okay?
Because I didn't know if it was like from lots of water. He consumes a lot of water. He's a good drinker.
I'd look at his electrolytes.
Okay.
And I don't have a clue what I'm talking about.
You look at his what?
Electrolytes.
Oh, electrolyte.
Gatorade.
Yeah.
Just because you're consuming a lot of water doesn't mean you're consuming quality water either. If your water has a lot of fluoride or chlorine in it, that can affect your body as well.
There could be something else going on, like Cushing's or something like that too.
I don't see any issues in the horse, and we do it just as a regular maintenance. He's healthy, he strides good, he runs good, he's happy, he doesn't have any issues, but he just always does it right there.
I wouldn't worry about it.
So, okay.
You might explain that to your vet a little bit. Your vet might be able to go further down the road as to what could be causing it in that area, but that's not my game.
Yeah.
want anybody thinking that I'm trying to practice medicine.
Yeah.
So what do you use the paddle for mostly?
The difference in the paddle, and as I explained this to the previous group, the machines are this machine, and the puts out what, just for conversation's sake, about 2 Tesla, which would be 20,000 gauss. This machine is designed to do that. The Pulse Pro machine is designed to be around 17,000 gauss, close enough that there's basically not a lot of difference in what's happening between the two. This will take that 20,000 gauss and turn it into about 38,000 gauss. Why? Because of the way it's wound. It's wound like a watch spring. So it comes out of this like a spotlight. You know, the police have, or the boat lights, you know, those kind of things. That's how it's coming out. So what we're going to get is a much finer penetration into the area like this, not like a fountain. All right? So it's just a manner of delivering the energy. I've had people that have come in, I've had some vets that have come in, and they use it, and they love it, and that's all they use.
That would be best for pinpointing.
It's excellent for pinpointing.
Pulling out an abscess.
Pulling out an abscess or something like that. Are we going? Keep coming. A little more. That's good. So it's really just like the other coils, except we are getting a little more, and you can get a little more pinpoint what you're looking for. If you want to trace something, you want to see where it's going.
So it's pretty much the bigger the attachment, the bigger area you're treating.
The bigger area you're treating. That's why the wave wings put out less, just for numbers' sake, the wave wings that we had on the Max or the Maya, maybe we're putting out 7,000 gauss. All right, but it looked like we were moving everything because the amount of tissue we're stimulating. Here we're stimulating a very small area of tissue, so you can turn it up higher.
Yeah.
All right. You can also use it to find sensitivity a little easier. I mean, it's amazing. You got it here and it goes away.
I'm really hard now.
I'm getting more right here than I'm getting over here. I'm getting some over here. So this can find it, work the area a little easier. The paddle is very effective if you want it. You know, some horses will let you wrap the hock and some won't. You can just put it right here, turned up a little bit. Keep going.
When I'm treating my horse's hops with the butterfly, he always tells me when 4 minutes is almost up.
Right. Okay. So you know we're putting a lot of energy right now into that hock, and he could care less.
Yeah.
How's his eye?
He's looking at you.
And he's licking and chewing. Not even touching it. Now I could touch it, and he's going to get more intensity.
Right.
Right. See, now he's thinking about it a little bit.
Yeah.
All right. So you don't want him, when I treat hocks, I don't want him thinking about it. I just want to get the energy in there to do the job. All right. So if I'm doing an aspirin point, I can come right here and treat his aspirin point to give him some relief like an aspirin. And so I'm coming out of this like this. So I'm treating the top of the hock, and I'm coming all down through here.